Bismillahirrahmanirrahim. Assalamu alaikum everyone. Today we will be discussing about the wrought alloys. This is the concluding lecture of our topic of metallurgy. So let's move on to objectives. So you should be able to describe and define what are wrought alloys and their role in dentistry. Explain the composition, properties and uses of the different wrought alloys, and to compare the properties of the different orthodontic wire materials. So the wire materials are also a part of the wrought alloys. First of all, what are wrought alloys? So wrought means basically beaten, and basically these are the cold work metals that have been plastically deformed at room temperature so that the shape of the structure and certain mechanical properties are altered. The different wrought alloys in dentistry include the wrought titanium and titanium alloys, the wrought stainless steel and its alloys, the wrought cobalt chromium, the wrought Niti or nickel titanium, and the wrought beta titanium. So, firstly, what are the clinical applications of wrought alloys? They are used in various restorations and prostheses, for example, in orthodontic wires, in glass for partial dentures, in endodontic instruments, in prefabricated pediatric crowns, and surgical and cutting instruments. The different types of wrought alloys, well, they include stainless steel, which are used to make orthodontic wires, pediatric crowns, endodontic instruments, surgical and cutting instruments and clasps. Then the nickel titanium or Niti, used for ortho wires and endodontic instruments. Coming to cobalt chromium, this is a base metal alloy. However, when it has been cold worked upon and beaten into the wrought form, it basically becomes a wrought alloy, and that is used in the partial denture framework. Beta titanium used in orthodontic wires, and the commercially pure wrought titanium. This is used exclusively for the fabrication of dental implants. So let's just go over cold working. We did it in the previous lectures. So this is a process in which a metal is hammered, drawn or bent into shapes at room temperature, which is well below the crystallization temperature of metal and often at room temperature. And so it's basically a kind of plastic deformation that we are carrying out to bring about certain changes in the alloys, which include increased hardness, strength and proportional limit. So we want to improve the mechanical properties. However, it causes a decrease in the corrosion resistance and ductility of the alloy. And then we studied about annealing. Annealing was basically a controlled heating and cooling process. The cooling was known as quenching, designed to produce the desired properties and eliminate the internal stresses of cold working. So the basic uh, goal is to optimize the properties of cold working and eliminate the internal stresses that were produced due to the cold working. Annealing is done at a certain temperature, which is half the melting point or fusion temperature of the alloy. And what does annealing do? It causes softening of the alloy, increases the plastic deformation potential, and improves the machinability and eliminates the internal stresses of cold working. Now, if you look at them separately, the effect of cold working on the alloy is that it decreases the ductility, and if you can recall, it also changes the granular structure and makes it more fibrous in nature. Annealing does the reverse. It increases the ductility, causes a softening effect, and this occurs in three stages. So, if you're asked about annealing, to define it, always remember to include the three stages of annealing, which are very important: recovery, recrystallization, and grain growth. So, recovery means the recovery of the ductility and corrosion resistance, which was lost due to cold working. Recrystallization is basically the process in which the crystalline grain structure is revived. So, basically, the crystalline structure, which got converted into a fibrous structure due to cold working, is converted back into its regular crystalline structure. This makes the metal soft and ductile, and it is a suitable quality of for clasps. And then finally, the last step, which is grain growth. So basically, coarse grain structure is produced and the grain boundary area is minimized. So these are the three stages of annealing. Now let's talk about the different wrought alloys individually. We will be discussing the stainless steel wrought alloys first. Stainless steel. Stainless steel basically the steel or alloy of iron and carbon which has 12 to 30% chromium. That is why it is called stainless. It is corrosion or rust resistant. And so remember, whenever you're asked that what is stainless steel, remember that it contains 12 to 30% chromium. And there are three types of stainless steel: ferrite, austenite, and martensite. If you look at the composition, the ferrite type is body centered cubic. I'm sure you're familiar with the crystalline structure. There's body centered, there's face centered, there's cuboidal, hexagonal, and various other forms of the crystalline structure. So, ferrite is body centered, and the chromium content is about 11.5 to 27%. There is no nickel, and carbon is present in about 0.2%. Austenite is face centered, and this contains about 16 to 26% chromium, a great amount of nickel, about 7 to 22%, and 0.25% carbon. Whereas the martensitic form, which is also body centered, it contains about 11.5 to 17% chromium, so it contains less chromium, and about 2.5% nickel, and carbon is present in greater amounts, 0.15 to 1.2%. So the composition is very important, and so is the crystalline structure. You should be aware of that. If we talk about the martensitic stainless steel, firstly, it is body sintered cubic. It can be heat treated. It has high strength and hardness, and it is used exclusively for the surgical and cutting instruments. And it is less corrosion resistant than the other types because of its low content of basically chromium. So remember the three things: that the crystalline structure, its mechanical properties, and its application. It is different from the rest of the stainless steel. Moving on to the ferritic stainless steel, this has less use in dentistry. Good corrosion resistance, however, strength is not adequate. It possesses a body centered cubic crystalline structure, and it cannot be heat treated or readily work hardened, so that means we cannot increase its mechanical properties. Talking about the austenitic stainless steel, it is basically face-centered cubic structured, most corrosion resistant of all types because it has high nickel content and chromium, and in dentistry widely used in the form of orthodontic wires, endodontic instruments, and pediatric crowns. So austenitic and martensitic stainless steel are important, basically their composition, the crystalline structure, and their applications. So this is basically a pediatric stainless steel, austenitic stainless steel crown. This is an orthodontic wire, also called austenitic stainless steel orthodontic wire. And these are the endodontic files used for the root canal treatment, also made up of austenitic stainless. Now, if you can recall, chromium has the role of providing a passivating effect or a protective effect by forming an adherent tenacious oxide layer which prevents corrosion, and this imparts the corrosion resistance in the alloy. Um, this is called passivation. However, loss of passivation may occur, and that is called sensitization. So, the opposite of passivation or the loss of passivation can is known as sensitization, and it can occur due to various factors. For example, if the percentage of chromium is less than 13 or more than 27%, this can lead to sensitization. If the patient has poor oral hygiene and there are heavy calculus deposits, this can lead to the loss of passivation, and also excessive heat treatment can lead to the loss of passivation or sensitization. Now let's look at the properties of stainless steel compared to other alloys. This table is present in your many of your textbooks, and it's a very good. This table is a very good way to memorize the properties of your different wrought alloys. If you look at the spring back ability, so that's low in stainless steel and the highest in nickel titanium. Stiffness is highest in stainless steel. Permeability is good. Stored energy is low. Biocompatibility is good. Joinability, it has the ability to be soldered and welded. However, friction is low. Let's talk about titanium and its alloys. As you are well aware, titanium is a very upcoming biocompatible biomaterial. It has a variety of properties which makes it favorable and popular to be used as a biomaterial in the human body. It has high corrosion resistance, it is biocompatible, low specific gravity, it is lightweight, and has good mechanical properties. So let's look at the properties. Firstly, it's corrosion resistant because just like chromium, it can form a stable oxide layer which prevents corrosion. Low density, which means lightweight prosthesis can be formed. It is very biocompatible. There are no known studies of any kind of reaction or toxicity taking place due to the placement of titanium. It has a low modulus, so it's less brittle, high strength compared to stainless steel, low conductivity, and adequate ductility, so it can be formed into any desired shape. So the properties of titanium is often asked in your UQs. Now, what are the clinical applications of titanium? There are two types of titanium. The commercially pure titanium, which basically contains about 99% of titanium and it has no other alloy. And it is used for the production of implants, crowns, partial dentures, and orthodontic wires. And then an alloy of titanium, Ti6Al4V. So it has aluminium and vanadium. And this is used for the production of orthodontic wires. Titanium alloys, basically, as mentioned, they may be alloyed with aluminium and vanadium, and these elements are added to stabilize the alpha or beta phases. So basically, there are two phases of titanium, alpha and beta. Alpha phase is strong, and the strength is due to aluminium, which is a stabilizer, and the beta phase basically contributes to the corrosion resistance, and this is due to either vanadium, palladium, or copper. So basically, uh, these two alloying elements contribute to both the strength and the corrosion resistance. Now let's talk about the orthodontic wires. What is the role of orthodontic wires? They are supposed to apply forces to the malaligned teeth to change their position and maintain the proper occlusion and in an ideal dental arch. What are the requirements of orthodontic wires? Well, they should have a good spring back potential. Spring back potential means that the wire is able to, it should have a certain degree of flexibility and elasticity so that it can carry out tooth movement by exerting forces on the tooth. And it should have high stiffness, should have the ability to be bent without fractures because we will be giving different bends and shapes to the wire, should be able to be soldered and welded. We'll be discussing soldering and welding. These are basically procedures to join two metals together. So because our wires will have different components on them, brackets and bands, and so that's why they all should be able to be joined to each other, and this is done by soldering or welding. They should have excellent corrosion resistance, and they should not degrade or basically corrode within the oral cavity. They should be ductile so they can be able to be formed into various shapes, and they should be cost effective. Now, orthodontic wires exist in two cross sections, e-circular and rounded. Stiffness depends upon their thickness, so increasing the thickness increases the stiffness. These are all technical considerations. Available materials of orthodontic wires: stainless steel, cobalt, chromium, nickel. Now, this alloy is known as algalloy. This is its commercial name. Nickel titanium or nitinol, beta titanium, and gold alloy. Gold alloy is obsolete. We do not use gold alloy orthodontic wires, so we'll not be discussing them. Now, starting with the stainless steel orthodontic wires. Stainless steel orthodontic wires are always composed of austenitic form, and they are known as 18 by 8 stainless steel. So, whenever you hear the term 18 by 8, remember the 18 stands for 18% chromium and the 8 stands for 8% nickel. And this is basically the orthodontic wires, which is made of 18 by 8 austenitic stainless steel. It is moldable, it has high modulus of elasticity, and it can apply large forces. However, it has low spring back potential, it is stiff, small diameters can apply small forces. It is usually annealed before use, and it can be soldered using gold and silver solders. Now, moving on to algalloy or the cobalt chromium nickel orthodontic wires, they are available as both as wires and bands. Composition is the same of the casting alloys cobalt chromium, except the percentage of cobalt and chromium, because nickel is present, so automatically the content of cobalt and chromium is reduced. Mechanical properties are similar to stainless steel, and they're available in four forms: soft, ductile, semi resilient, and resilient. Now, the beta titanium orthodontic wires. These are the crystallographic form of titanium when we heat it above 885 degrees, and certain alloying elements are added like vanadium, molybdenum, and tantalum, which stabilize the beta form. Composition basically it's composed of 78% titanium, 11.5% molybdenum, 6% zirconium, and 4.5% tin. Let's look at the mechanical properties of beta titanium. Well, it has a very low elastic modulus. It's not very stiff. However, it has excellent spring back. Yield strength to elastic modulus ratio is very good. It can be easily cold work, and it is highly ductile. So we can basically make any kind of desired shapes we want. It has good formability compared to austenitic stainless steel. It is highly corrosion resistant due to the presence of titanium. It has environmental stability, which means it will not degrade or not leach out any ions. However, one drawback is that it cannot basically be heat treated. We cannot carry out soldering or welding on beta titanium alloys. What is stainless steel? Stainless steel basically a steel or alloy of iron and carbon which has 12 to 30% chromium. That is why it is called stainless. It is corrosion or rust resistant. And so remember, whenever you're asked that what is stainless steel, remember that it contains 12 to 30% chromium. And there are three types of stainless steel: ferrite. Now let's talk about nickel titanium or nitinol or shape memory alloys. It's also known as shape memory alloy. Composition basically there it contains 55% nickel and 45% titanium. Small amounts of copper, cobalt, and chromium may be added, and it also exists in two forms. The clinical applications basically, their nickel titanium is used in two places: for the fabrication of orthodontic arch wires and endodontic instruments. Let's look at the properties. Two unique properties are present in nickel titanium: the shape memory and super elasticity. So the two phases of nickel titanium, like stainless steel, it exists in two forms, austenitic and martensitic, but do not confuse the two. They're totally different from stainless steel. Austenitic is basically a high temperature, low stress form, and it has a complex ordered body centered cubic structure, whereas martensitic is a low temperature, high stress form, so it's opposite of basically austenitic, and it may have a distorted monoclinic, triclinical, or hexagonal structure. So, as you can appreciate from the picture, that the austenitic form is basically more complex and ordered, whereas the martensitic form is distorted or irregular in structure. So, this is very important. You should know the crystalline structure as well as the difference between both. That one is formed at the high temperature, and the other, the martensitic, is formed at low temperature. Now, these two phases are interchangeable. It is possible that one form may convert into the other according to the conditions. So, high temperature, low stress form gives rise to austenitic, and high stress and low temperature can give rise to the martensitic form. So, they are interchangeable depending upon the condition provided. Now, a very important term, the transition temperature range. As I mentioned in the previous slide, that these two forms are interchangeable. So basically, the temperature range at which these phases interchange or the transition occurs is called the transition temperature range, or the TTR. This is very important because this corresponds to the temperature variations in the oral environment. Obviously, as you know, the oral cavity, we are ingesting hot and cold food, so there is a change in the constant change in the temperature. So this corresponds to the transition temperature range. This information is important for the orthodontist, because if he or she knows the temperature transition temperature range of the certain alloy, he can or he or she can determine the mechanical performance of the archwire during treatment, and he or she can manipulate this information to provide the desired tooth movement and basically achieve good results. So it is seen that below the TTR, Niti possesses the Martensitic form, and above the TTR, it returns to its original shape. That is why Martensitic is known as the low temperature form, and austenite is known as the high temperature form. So if we basically austenite at room temperature, when it is cool, it converts into martensite, and martensite, when it is heated, it converts into austenite. As I mentioned, that they're interchangeable, and the whole temperature range at which this is taking place is called the temperature transition. Now let's talk about the two unique properties, the shape memory effect and superelasticity. Shape memory is basically, like I mentioned, a property which is unique to the nickel titanium alloys. And shape memory means that these alloys possess an internal memory. They can remember and they can convert back to their original shape. So basically what happens is that when the transition temperature range is lowered to the oral temperature, a shape memory effect is created. So orthodontic wires, they basically are formed, they are present as austenitic form at room temperature. When the orthodontist wants to bring about the desired tooth movement, he or she makes certain bends and gives certain shape to the wire at a temperature, at a high temperature, and then when he or she places it back in the oral cavity, so what happens is that there is a temperature drop. Now this temperature drop causes the conversion of austenite to martensite, and as a result the wire is able to get back into its original shape. So it remembers the shape it was in, and it automatically reverts back to its original shape. As you can see from the diagram, that basically the wire straightens as soon as it's placed in the oral cavity. So this is due to the shape memory effect, and that takes place when takes place when there is a temperature range and the conversion is from austenite to martensite. And this is very important and an advantage of NITAB, because we don't have to give any bends again when placed in the oral cavity. It automatically reverts back to its original shape. So this is a diagrammatic representation of shape memory. As you can see, this is a nitinol wire bent into any shape when cold or at a certain temperature, and then when we heat it, it reverts back to its original shape. So which means that when it is placed back into the oral cavity, it returns to its original shape. So this is shape memory effect, a very important feature of nitinol wires, and it is very commonly asked in your viva as well as your UQs. So you should know the definition and the clinical significance of this property. Moving on to superelasticity. So superelasticity basically is also a unique feature of nickel titanium alloys, and they are super elastic, which means that we do not need to apply large and great amounts of forces to get the desired tooth movement. We just have to apply very low forces, and because there is an inbuilt super elasticity, just applying a little bit of stress produces a large amount of tooth movement. Because what will happen if we apply large and intermittent forces, it will basically damage the tooth, cause root resorption, and it will definitely be painful for the patient. So what happens, basically, when we apply force or we induce any stress, there is again a conversion from the austenitic to the martensitic form. So basically, in both super elasticity and shape memory, there is a conversion from austenite to martensite. However, in shape memory, the change is due to temperature, and in case of super elasticity, this change is due to stress. So that is the major basic difference between super elasticity and shape memory. This diagram basically explains it in a much better way. Shape memory is thermally induced at oral temperature, super elasticity is mechanically or stress induced, and there is a phase transformation from austenitic to martensitic. And obviously, again, if we cool down the martensitic form, it converts into the austenitic form at room temperature. So the mechanical properties of nickel titanium, apart from the shape memory and super elasticity, it has low modulus of elasticity. It's not stiff, very good spring back, and However, the drawbacks are that it is expensive, it requires special bending technique and expertise. It is brittle, it cannot be soldered or welded or any kind of heat treatment. It has a rough surface. Now let's move on to the endodontic instruments. We discussed the orthodontic arch wires. So basically, there are different endodontic instruments that we use in the root canal treatment. So they include reamers and files, spreaders. So they are basically all used to carry out root canal treatment. And the materials of the endodontic instruments may be stainless steel or nickel titanium. And if we look at the requirement in endodontic materials, it is important that our instrument should be super elastic because we have to reach within the root canals, so they should be elastic, so they do not fracture uh, right in the middle, and they reach to the end of the canal, and so we are able to take out the dead tissue or the pulp. So basically, that's what we are doing. We're debriding the pulp, and so if they're elastic, then only will they be able to go inside and carry out their function. They should have shape memory ideally, so that when we go to the certain length, it remembers the length of the canal and does not cross the apex. And it should have different values of stiffness, and ductility is required. So basically, the requirement of endodontic instruments is different, but most importantly, it should be super elastic and should be ductile and should ideally possess shape memory. So finally, let's look at the mechanical properties of orthodontic wires. Now, this is a very frequently asked question. You're asked to write down or tabulate the properties of orthodontic wires. So, these four materials are what you'll be talking about: stainless steel, cobalt, chromium, nickel, or alkali, nickel, titanium, and beta titanium. It is best that you make it into a table form. This table is basically from your textbooks. It's present in all your textbooks. So let's look at the modulus of elasticity or the stiffness. It is greatest in cobalt, chromium, nickel, followed by stainless steel, then beta titanium, and nickel titanium. If we look at the ultimate tensile strength, we can see that stainless steel has the high strength, followed by cobalt, chromium, nickel, then the nickel titanium, and the least strength is of beta titanium. So we can easily say that the stainless cobalt chromium nickel is the stiffest of all, but the strength is the most in stainless steel orthodontic wires. Number of 90 degrees bends without fracture. So this is highest in cobalt chromium nickel. Again, this means that 8 bends can be given before fracture, and it is least in the nickel titanium. So because obviously the strength is also low, and it will fracture earlier than the rest of the alloys. So this brings us to the end of our topic of metallurgy. Um, we've covered basically the noble metal alloys, the base metal alloys, the wrought alloys, and thank you so much for your time.